Hello everyone, it's May the 20th. I'm Dr. Adam London, Director of the Kent County Health Department, here for today's COVID-19 update. Across the state of Michigan, there are 52,350 diagnosed cases of COVID-19. That's an increase of 435 over yesterday's number, and 5,017 deaths statewide. That's an increase of 102 since the last day's report. Here in Kent County, we're at 3,020 diagnosed cases of COVID-19. Our 3-day rolling average is 54, so we continue to see good news there. That 3-day rolling average continues to trend downward, and our days to double our caseload has increased to 25.4 days, which is another good indicator. We're now at 59 deaths. We did unfortunately lose one more person to COVID-19 yesterday. However, 1 out of the 102 deaths statewide is a very small number. It's less than 1%, of course, and so we continue to be a very small portion of the death toll statewide. And as of today, we're reporting 1,381 recoveries here in Kent County. Still getting a lot of questions about why we have so many cases reported here in Kent County. In fact, we have the 4th highest rate of cases of all of the 83 counties in Michigan. Why is that? Well, I want you to keep in mind that we have more testing availability here in Kent County, especially because of the great work that our hospitals have done. And here at the health department, we're going out aggressively looking for a virus and testing some of those highly vulnerable environments. So I mentioned we have the 4th highest rate of cases in the state, but consider that we have the 30th highest rate of death in the state. So our testing is very high, our positives are very high, but our deaths are relatively low or in the middle group. This disparity, I think, is another sign indicating that we're doing a good job, relatively speaking, of getting testing in the community, and that our deaths are not nearly as high as what you might think they would be if we really had a high rate of illness in the community compared to other counties. Also interesting is that while our case fatality rate statewide is about 10%, that's about 10% of the diagnosed cases die. Here in Kent County, it's less than 2%. Again, showing that our testing is much higher relative to other counties. Our positivity rate continues to decline. Early on, we were seeing 20 or 30% of the tests that we submit coming back positive for COVID-19. That has continually trended downward. We're now at less than 7% of our tests coming back positive. That's a great sign. So more test accessibility, more aggressive testing strategies, these are the reasons why you're seeing more cases in Kent County than in some other counties. The governor has a goal of doing 30,000 tests per day statewide in the month of June. If Kent County has, let's say, 10% of the state's population, it's actually less than that, but just for easy math, that would mean that we should be doing 3,000 tests per day here in Kent County. We actually right now have the capacity to do much more than that. We can probably do 5,000 or more tests a day in Kent County right now. So we have the capacity for testing here in Kent County. We're seeing our numbers trend in a positive direction. We're seeing that our mortality rate is very low, especially compared to the rest of the state. And we're seeing that, that we're getting out and finding people who are infected before these small individuals or small clusters can turn into large clusters. We also continue to see that our hospitals are in very good standing. They have lots of capacity. They all report on a regular basis that they have rooms and ventilator capacity, so they're in great shape. So in sum, Kent County, you're doing a great job. Keep doing the things that are smart to make it difficult for this virus to spread person to person. Do those things and we're going to be just fine. I'm Dr. Adam London, Director of the Kent County Health Department, encouraging you to stay positive, stay heroic, and stay healthy. Thank you, and I'll talk to you again tomorrow.